After a brief week on holiday, we are back with this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will be once again discussing key events these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to August 14, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. The second week of August 2025 in the Middle East saw a dynamic interplay between health innovation and urgent humanitarian needs. Across the region, governments advanced ambitious healthcare policies and cross-border partnerships even as conflict-related crises underscored persistent public health challenges. Several Gulf states accelerated national health transformation plans, from digital health breakthroughs in Saudi Arabia and Bahrain to pharmaceutical pricing reforms in Kuwait, aligning with long-term visions like Saudi Vision 2030 and Kuwait's Vision 2035. At the same time, major public health campaigns in Egypt and the UAE focused on preventive care, wellness, and community engagement. However, the grim realities of war and displacement loomed large. Gaza's devastated health system struggled with deadly disease outbreaks and shortages, prompting emergency interventions by regional actors. In tandem, conflict-adjacent countries like Iraq and Jordan pursued infrastructure upgrades and cooperation to bolster resilience. This week's developments reflect a region striving to modernize healthcare and improve well-being against a backdrop of ongoing hardship. First is healthcare policy and government initiatives. Government-led regulatory oversight and patient safety. In Qatar, authorities took decisive regulatory action to uphold care standards. The Ministry of Public Health announced on August 14 the closure of a private health center for failing to meet required specialist staffing levels. In a separate case, it temporarily shut an obstetrics unit and suspended a practitioner's license for operating beyond their scope. These enforcement steps are part of ongoing oversight efforts to ensure all facilities comply with national health regulations and prioritize patient safety. Similarly, in Oman, the government strengthened public-private collaboration to expand critical services for vulnerable patients. On August 14, Oman's Ministry of Health signed a financing agreement with Oman India Fertilizer Company, OMIFCO, marking the 6th consecutive partnership to fund home ventilators for low-income patients. Officials lauded this corporate social responsibility initiative, noting it will shorten hospital stays, reduce infection risks, and ease burdens on families by enabling chronic respiratory patients to be cared for at home. These examples highlight how Gulf states are leveraging policy tools and partnerships to enhance healthcare quality and accessibility. National health strategies and reforms. Policymakers also advanced broad strategic reforms. In Kuwait, the Ministry of Health enacted sweeping pharmaceutical price reductions to improve affordability. On August 11, Health Minister Dr. Ahmed Al-Awadhi ordered price cuts of up to 78.5% on 544 drugs and medical products, including cancer therapies, antibiotics, and medications for chronic conditions like diabetes, hypertension, and asthma. This repricing initiative, which sets some medicines at the lowest Gulf prices, reflects a national policy for continual drug price review aimed at economic efficiency and relieving cost burdens on citizens and residents. Meanwhile, Saudi Arabia continued to pursue its Vision 2030 health objectives. Although just prior to this week, the health minister lauded the kingdom's Healthy Cities program for accrediting 16 cities, including the first Middle Eastern cities over 2 million population to earn the designation. This initiative, aligned with a health in all policies approach, has been integrating health promotion into urban planning to improve quality of life. The ministry affirmed plans to expand the Healthy City network, demonstrating Saudi Arabia's commitment to preventive health and sustainable, livable cities. Additionally, Egypt and Jordan deepened bilateral cooperation in health policy. At the Egyptian-Jordanian Higher Committee meetings on August 12, officials agreed to activate previously signed Memoranda of Understanding between the two countries' health ministries. This will revive joint work on health projects as part of a broader package of MOUs, also covering industrial zones and SMEs, intended to strengthen economic and social ties. Such regional partnerships underscore a trend of Middle Eastern governments collaborating on healthcare improvements and knowledge exchange. Government initiatives in humanitarian health, recognizing the acute needs in conflict zones, regional authorities also funneled support to humanitarian health efforts. Bahrain's government earned praise for championing the Bahrain Declaration, adopted at the 2024 Arab League Summit, which sets a regional agenda for improving care of conflict-affected populations and expanding access to essential medicines. This week, whose regional director commended Bahrain's leadership in pushing forward that humanitarian health vision, including initiatives to boost regional vaccine and pharmaceutical production. Likewise, Saudi Arabia and the UAE continued deploying their aid agencies to crisis areas, detailed in sections below. Overall, the week's policy moves show Middle Eastern governments balancing domestic reform with regional solidarity, using policy levers to strengthen health systems at home while contributing to stability and health security across borders. So how about life sciences and research innovation? Genomic medicine and advanced therapies, the region marked significant firsts in medical research and applications. In Bahrain, doctors achieved a groundbreaking gene-editing therapy milestone. The Bahrain Oncology Center successfully used a CRISPR-based gene-editing treatment for a sickle cell disease patient, the first such application in the Eastern Mediterranean region. This pioneering use of CRISPR technology, highlighted during a WHO visit, underscores Bahrain's investment in cutting-edge science to tackle hereditary diseases. It also reflects the country's emphasis on integrating innovation into all levels of care, a pillar of Bahrain's National Health Plan 2016 to 2025. The achievement not only offers new hope for genetic blood disorders in the Gulf, but positions Bahrain as a regional leader in advanced therapeutics and precision medicine. Biotech breakthroughs under sanctions. In Iran, new data showcased the nation's resilience and progress in biotechnology and regenerative medicine. Iranian officials announced that Iran has leapt to 8th place globally in stem cell therapy research and treatment, up from 12th last year. Over the past year, Iran increased its portfolio of domestically developed cell therapy products from 1 to 5, accelerating its international ranking. This advance comes despite heavy sanctions, and Iranian scientists aim to reach the top 5 worldwide while making such treatments available locally so that patients need not seek care abroad. The country also unveiled major initiatives to achieve pharmaceutical self-sufficiency. 2 flagship projects are underway to begin local production of insulin and blood plasma products, which have been among Iran's most costly health-related imports. Iran currently spends over $300 million annually on imported plasma, and similarly large sums on insulin. Officials expressed confidence that within 2 years domestic manufacturers will meet national demand, ending reliance on imports. This would not only save foreign currency and secure supply under sanctions, but also strengthen Iran's health economy through local biotech industry growth. Notably, Iran already holds an unrivaled regional position in biopharmaceutical production and ranks 5th in Asia in this field, with no shortages of biological medicines reported even under sanctions. Together, Bahrain's and Iran's strides, one in gene therapy, the other in biomanufacturing and cell therapy, highlight how Middle Eastern researchers are contributing to global medical innovation. These developments promise to improve treatment options for genetic diseases, diabetes, and other conditions, while fostering homegrown scientific expertise. Research collaboration and conferences. The week also featured efforts to share knowledge and build research networks. In Bahrain, the WHO Regional Director's visit, August 4 to 6, included a roundtable with academics at the Arabian Gulf University focusing on training future health professionals in fields like antimicrobial stewardship. Emphasis was placed on preparing the workforce with research skills and resilience and foresight to tackle evolving public health challenges and to advance evidence-based practice. Meanwhile, regional forums continued to underline science cooperation as a tool to overcome challenges. For instance, Iran's progress was attributed in part to high-level support for science and technology. The head of Iran's biotech initiative stressed that innovation is a strategic asset and called for more coherent coordination of research efforts nationally. Across the Middle East, a theme emerging this week is that investment in life sciences and research infrastructure is yielding tangible breakthroughs, even as researchers navigate political and economic constraints. These innovations are poised to translate into better health outcomes and affirm the region's growing role in the global scientific community. Biotech and pharmaceutical developments are innovating and expanding. Our next topic. Affordable medicine initiatives. Ensuring access to essential medicines was a priority in several countries. As noted, Kuwait's Ministry of Health instituted major price cuts on hundreds of pharmaceutical products. This included repricing 144 drugs at the lowest Gulf Cooperation Council (GCC) price points and reducing the cost of 544 drugs and medical supplies by up to 78.5%. The reduced price list covers medications for cancer, antibiotics, and treatments for chronic illnesses, diabetes, hypertension, cholesterol, asthma, arthritis, etc. Kuwait's health ministry stated these cuts align with a national policy of continuous drug price review to promote economic efficiency in healthcare and ease financial strain on patients. By making medicines more affordable, Kuwait aims to improve adherence to treatments and overall public health, while also moving toward sustainable health financing. Localizing pharmaceutical production. The drive for self-reliance in pharmaceuticals was evident in Iran's announcements. Iranian officials revealed plans to eliminate imports of insulin and blood plasma through domestic production capacity coming online. Within 2 years, Iran expects local biotech firms to meet national needs for insulin, critical for diabetes care, and plasma-derived therapies, a move that will save the country hundreds of millions of dollars annually. This initiative reflects a broader trend of Middle Eastern countries investing in local pharmaceutical manufacturing, not only to reduce costs and import dependence, but also to mitigate risks from global supply disruptions and sanctions. Iran's success in maintaining adequate supplies of biological medicines despite external pressures was highlighted as an example of how building robust internal production can ensure medication security. In the same vein, regional cooperation on pharmaceutical manufacturing gained mention during Bahrain's engagements with WHO. Bahrain is actively supporting regional pharmaceutical and vaccine production expansion, per the Bahrain Declaration, to improve access in conflict-affected and low-resource settings. Such efforts suggest a strategic shift wherein Middle Eastern nations seek to become producers and exporters of medical products, leveraging biotechnology advances. Medtech innovation and industry growth. Beyond drugs, medical technology innovation featured in the news. For instance, reports noted that Iran unveiled 3 cutting-edge medtech innovations at the Innotex 2025 exhibition, details of which include advancements in cardiovascular devices and diagnostics. While specifics from this week's expo were sparse, the showcase signaled Iran's intention to commercialize medical technologies and attract investment despite sanctions. Additionally, an industry report lauded Iran's growing biotech sector and its aims to contribute substantially to GDP in coming years. Elsewhere, the UAE's health sector continued to attract global partnerships, with ongoing efforts, notably by Abu Dhabi's initiatives, to bring multinational pharma research and manufacturing into the country, though no specific new deals were announced this week. Overall, the region's pharmaceutical and biotech landscape in mid-August 2025 is characterized by aggressive pricing reforms to benefit patients, parallel moves toward domestic production for long-term sustainability, and a pipeline of medical innovations emerging from local research. These developments point to a more self-sufficient and innovative Middle Eastern pharma-biotech industry in the making. Now, always full of developments is public health challenges and disease outbreaks. Gaza health system on the brink. The humanitarian health emergency in the Gaza Strip dominated regional public health news. 22 months of war have decimated Gaza's medical infrastructure and created fertile ground for disease outbreaks. A new analysis in the Lancet Infectious Diseases revealed an alarming spread of multi-drug-resistant bacteria in Gaza. Researchers found that 2/3 of patient samples at one of the few remaining functional laboratories, at Al-Ali Hospital, harbored antibiotic-resistant organisms. Experts warned this surge will lead to longer, more severe illnesses and higher fatality rates from infections that were previously treatable. The spread of drug-resistant disease is fueled by the collapse of sanitation systems, accumulating waste, malnutrition, and the massive influx of war injuries in Gaza's densely packed population. With hospitals lacking basic supplies and diagnostics, routine infections now pose life-threatening risks. On August 12, the World Health Organization urged Israel to permit stockpiles of medical goods into Gaza, describing the health situation as catastrophic. WHO officials noted Gaza has run out of more than half of essential medicines, and cumbersome border procedures are still severely limiting humanitarian shipments. Without immediate action, Gaza faces the nightmare of uncontrolled epidemics on top of conflict wounds. In parallel, Gaza's capacity to treat critical non-communicable conditions has collapsed, putting lives of thousands of patients in peril. A heart-wrenching report on August 13 highlighted that over 16,000 patients in Gaza need medical care outside but are trapped by Israeli exit restrictions. In the past 4 months, only a trickle of medical evacuation permits have been approved. At least 600 patients have died waiting for referral out of Gaza. One widely reported case is 8-year-old Abdel Karim, whose kidney failure turned life-threatening because he could not get specialized treatment abroad. He has endured months of painful dialysis and is now severely malnourished, yet still awaits Israeli approval to travel for care. Health officials say the backlog for Gaza medical exit permits is so large that, at the current pace, it could take 5 to 10 years to clear. In the meantime, preventable deaths mount. Doctors in Gaza are helpless, often forced to simply write referrals they know are unlikely to be honored. The WHO has called the evacuation delays torturous and emphasized that many Gaza patients will not survive unless they are permitted to leave promptly. This week's sobering reports from Gaza underscore an unfolding public health catastrophe. Trauma, hunger, and communicable disease are converging in a besieged population with minimal access to care. Emergency aid and outbreak response. Regional actors responded to these challenges with targeted aid. The United Arab Emirates delivered an urgent shipment of medicines and medical supplies to Gaza on August 14 as part of its ongoing Operation Chivalrous Night 3 relief mission. Coordinating with WHO, the UAE sent truckloads of essential drugs and consumables to help address acute shortages at Gaza hospitals like Nasser Medical Complex in Khan Yunis. The supplies aim to boost hospitals' capacity to handle emergencies at a time when they are overwhelmed and running out of nearly everything. UAE representatives stressed the aid is intended to serve as a lifeline to prevent Gaza's healthcare system from complete collapse and to save the lives of the sick and wounded. This shipment is one of a series planned in coming weeks, a recognition that continuous support is needed to stabilize health services in Gaza. Elsewhere in the region, infectious disease threats remained a concern. In Yemen and Syria, which are suffering protracted crises, there were no major new outbreak incidents reported during this week, but health authorities and aid agencies remain vigilant. It is worth noting that just beyond the region, a severe cholera outbreak in neighboring Sudan has killed dozens in a week, illustrating how quickly communicable diseases can surge in humanitarian settings. Regional surveillance is on high alert for polio, after an infant case was confirmed in Gaza earlier this year amid collapsing sanitation. While not a headline this week, UNICEF and WHO have been working on emergency polio immunization in Gaza to prevent spread to neighboring countries. Meanwhile, extreme heat waves across the Middle East continue to pose public health challenges, especially for outdoor mass gatherings. In Iraq, millions of Shia pilgrims undertaking the Summer Arbin pilgrimage face temperatures over 45 degrees Celsius, prompting Iraqi health teams to deploy along routes with water, first aid, and warnings about heat stroke. Regional health ministries have been issuing heat advisories and encouraging hydration to mitigate heat-related illnesses. In summary, the week's public health landscape was marked by the dual burden of conflict-driven crises and the seasonal, environmental challenges endemic to the region. While Gaza's humanitarian health disaster justly garnered international attention, other Middle Eastern countries are also navigating ongoing disease control and emergency preparedness efforts. The events underscore an urgent need for sustained humanitarian access, reinforced health infrastructure, and conflict resolution to address the root causes of these public health emergencies. Now let's speak to wellness and health promotion. National health campaigns. Several countries reported significant progress in large-scale health and wellness initiatives aimed at improving population health and preventive care. In Egypt, the Ministry of Health's ongoing 100 Days of Health campaign has delivered an enormous volume of free health services nationwide. As of August 9, 24 days into the campaign's third edition, over 37.8 million free medical services had been provided to Egyptians. Earlier in the week, officials announced that in just the first 21 days, July 15 to August 5, the campaign logged more than 32.5 million services across 12 health sectors. These included primary care checkups, chronic disease screenings, specialty consults, surgeries for patients on wait lists, ambulance emergency responses, and more. On one day alone, 1.82 million services were rendered, demonstrating the extensive reach of this nationwide effort. Complementing the clinical care, the campaign also conducted community wellness outreach, engaging nearly 100,000 people in health education at malls, clubs, and public spaces to promote healthy behaviors and awareness of available services. Health officials emphasize that 100 Days of Health takes a holistic approach, integrating curative services with prevention and education as a pillar of Egypt's strategy to achieve universal health coverage. The campaign's rapid scaling and millions of beneficiaries highlight a strong public uptake of free preventive services, which could translate into better health outcomes if maintained. Similarly, in Saudi Arabia, the government's Healthy Cities, Healthy Communities programs, noted earlier, represent a wellness-oriented policy to redesign urban environments for healthier lifestyles. While no new statistics were released this week, Saudi authorities remain committed to expanding health promotion through urban planning, sports, and lifestyle initiatives under Vision 2030. Awareness and screening programs. The week of August 7 to 13 also included observances of global health days that spurred local campaigns. August 13 was World Organ Donation Day, and the UAE mobilized both public and private sectors to raise awareness on organ donation and transplantation. The Ministry of Health and Prevention, MOUs, and its partners organized events to encourage residents to register as organ donors. Notably, NMC Healthcare, one of the UAE's largest private hospital groups, launched a 3-day educational series in alignment with MOHAP's HOYOT National Organ Donation Program. Starting August 13, NMC hosted public info sessions at 5 major hospitals across Abu Dhabi, Dubai, and Sharjah, teaching attendees about how organ donation works and how to sign up as donors. The initiative aims to demystify the process and inspire more people to become organ donors, potentially saving lives of patients awaiting transplants. Health officials, including NMC's chief clinical officer, highlighted personal stories of how organ donation transforms lives, from kidney failure patients freed from dialysis to those awaiting heart or lung transplants, to drive home the impact of the cause. Concurrently, the Dubai Healthcare City Authority held an organ donation awareness symposium on August 14, reinforcing the message at an emirate level, in coordination with the federal HOYOT program. These efforts align with the UAE's broader push to foster a culture of donation. Following legal reforms in recent years permitting organ transplantation, the country is building both the infrastructure and public willingness necessary for a successful transplant system. Additionally, the first week of August was World Breastfeeding Week, and regional health ministries, notably in the Gulf, wrapped up campaigns promoting breastfeeding for infant wellness. For example, Bahrain and Qatar ran media messages emphasizing breastfeeding's benefits, in line with WHO UNICEF's theme of "Let's make breastfeeding at work, work." In Bahrain, this coincided with WHO's recognition of the kingdom's maternal and child health initiatives that contributed to its elimination of mother-to-child transmission of diseases like measles and rubella. While not a headline event, it illustrates the continuum of wellness promotion from infancy onwards. Community and youth engagement. Another notable aspect of health promotion this week was multisectoral community engagement. WHO's regional director in Bahrain applauded the whole-of-society approach Bahrain is taking, engaging not just the health ministry, but also the Interior Ministry, Youth Affairs Ministry, and Sustainable Development officials to integrate health objectives into all policies. Bahrain's model of intersectoral healthy public policy led to it receiving prestigious awards like the Nelson Mandela Award for Health Promotion and Kuwait's Regional Prize for NCD Control. Community-based programs were also evident in other countries. Oman celebrated successes of local women's groups in health education, e.g. ongoing efforts in maternal health and chronic disease awareness at the village level, and Jordan prepared to host health fairs providing screenings and school physicals as summer ends. These grassroots elements, though not always front-page news, form the backbone of sustainable wellness improvements. In summary, the region's health promotion activities during the week demonstrate a strong commitment to preventive care and public engagement. By delivering free essential services at massive scale, as in Egypt, championing healthy lifestyles and disease prevention, Saudi and Bahrain, and galvanizing communities around critical causes like organ donation, UAE, Middle Eastern health authorities are striving to shift healthcare from a reactive model to a proactive, wellness-focused paradigm. Over time, these campaigns and programs are expected to reduce disease burden and complement clinical care advancements. Digital health innovation is our next topic. Digital maturity milestones. Middle Eastern healthcare providers continue to gain international recognition for digital transformation. In Saudi Arabia, a leading private hospital attained the highest level of electronic medical records integration. On August 7, Dr. Solomon Farki Hospital in Jeddah was revalidated at Stage 7 on HIMSS's Modernized Electronic Medical Record Adoption Model, EMRAM. This denotes the hospital's full digitization of patient records and advanced analytics use, placing it among an elite class of paperless hospitals globally. The Jeddah facility had first achieved Stage 7 in 2021 and successfully maintained that status under newly updated, more stringent criteria, a feat which HIMSS called a testament to sustained innovation and operational excellence. The one-day virtual assessment noted the hospital's strong governance, strategic planning, and a culture supportive of digital health improvements. For example, Farki Hospital had implemented real-time performance dashboards giving clinicians instant access to key metrics, and it managed to preserve this high functionality even as standards evolved. The hospital's leadership shared that partnering with HIMSS frameworks over 5 years enabled continuous improvement across departments. By meeting the pinnacle of EMR maturity, the Jeddah Hospital joins other regional digital health leaders, such as Riyadh's King Abdulaziz Medical City, which recently reached Stage 7 on the analytics maturity model, in showcasing Saudi Arabia's health IT advancements. These achievements will be highlighted at the upcoming World Health Expo in Dubai, where top Middle Eastern institutions driving digital transformation are set to convene in September. E-health collaboration and virtual care. Digital health was also a focus of international cooperation. In early August, Saudi and Iraqi health ministers met in Riyadh to deepen bilateral ties in health, with digital health and virtual care high on the agenda. During the August 5 meeting, the ministers signed an MOU to collaborate on health system development, specifically emphasizing public health surveillance, preventive medicine, and the expansion of telehealth services and digital platforms. The Iraqi delegation toured Saudi's cutting-edge health technology centers, including the Seha Virtual Hospital, a nationwide telemedicine hub, and the Health Ministry's Command and Control Center, to learn from the kingdom's experience in deploying advanced e-health solutions. Iraq, which is rebuilding its healthcare infrastructure, stands to benefit from Saudi expertise in implementing digital patient records, AI-driven analytics, and teleconsultation networks. This kind of knowledge exchange indicates how Gulf countries are emerging as regional mentors in digital health. Likewise, GCC-wide efforts to unify and digitize health services made news. The UAE's MOHAP announced plans, with an eye toward 2026, for a national unified digital health platform to integrate licensing and patient records across all Emirates. While that initiative is in a planning phase, it reflects the trajectory toward interoperability and one-stop e-health services in the UAE. Innovative health tech applications. Several countries reported novel uses of digital tools to enhance care delivery. In Iraq, in preparation for the massive Arbin pilgrimage, authorities introduced a smart bracelet program to prevent lost children during the pilgrimage crowd, a simple wearable tech solution to quickly reunite separated families among millions of pilgrims. In Bahrain, WHO observers noted how integration of technology at primary care level is central to Bahrain's model. For instance, Bahrain's primary health centers use integrated information systems that allow a people-centered continuum of care, cited as a regional model for strengthening primary healthcare. And in Iran, beyond the biotech sphere, technologists are pushing digital health startups. Tehran hosted an innovation showcase where health tech entrepreneurs demonstrated products like AI-driven diagnostic tools and telemedicine platforms, indicative of Iran's growing health startup ecosystem. Efficiency and service quality gains. In the UAE, digital innovation is also targeting efficiency in customer service. Dubai's health authorities reported progress in their Zero Paperwork initiative for licensing, having digitized and streamlined dozens of services to cut processing times by 50%. This week, the UAE also expanded its national patient satisfaction e-surveys and AI-based customer happiness indices, as part of a new service excellence roadmap launched on August 3 to enhance user experience in healthcare. These government-led digital reforms aim to make accessing health services more convenient and transparent for the public, aligning with the UAE's smart government vision. Taken together, the developments of this week illustrate that Middle East healthcare is steadily embracing digital innovation, from electronic records and telehealth to AI and smart devices, to improve care quality and access. The fact that regional hospitals are attaining global digital maturity benchmarks and countries are cooperating on e-health strategies bodes well for the future. As these technologies scale up, patients in the region can expect more coordinated, data-driven, and patient-friendly health services. Importantly, the ongoing investments in digital infrastructure and skills are helping health systems become more resilient, a benefit that has been crucial during crises like pandemics and will continue to enhance emergency response and routine care alike. Let's now finally speak to population health management. Disease elimination and vaccination successes. Despite acute challenges, countries are making headway in managing diseases at the population level. Bahrain emerged as a regional exemplar in disease control. The WHO confirmed that Bahrain has maintained polio-free status and eliminated endemic measles and rubella, thanks to high immunization coverage and robust public health programs. The kingdom's comprehensive vaccination efforts and rapid response to outbreaks, as evidenced by its COVID-19 strategy earlier and ongoing surveillance for other diseases, have been internationally recognized. Bahrain's achievements in preventative health were honored by awards such as the WHO's World No Tobacco Day Award and regional prizes for controlling cancers and non-communicable diseases. These honors underscore how sustained investment in population health management, including nationwide screening initiatives and health promotion, e.g. Bahrain's active anti-tobacco and diabetes prevention campaigns, can yield measurable declines in disease incidence. Mass gatherings and public health planning. Managing the health of large populations during mass events was a priority in Iraq and Saudi Arabia this week. Iraq, gearing up for the influx of an estimated 20+ million Shia pilgrims for Arbin, in late August, early September, implemented a detailed health management plan. In addition to opening the new hospital in Wasit, mentioned in hospitals section, Iraqi health authorities have deployed thousands of medics and set up dozens of temporary medical posts along pilgrimage routes. They are monitoring for communicable diseases, ensuring water sanitation in makeshift rest stops, and prepared an emergency response in case of outbreaks. Indeed, a scare occurred when over 600 pilgrims were hospitalized due to a chlorine gas leak incident at a rest station, but Iraqi hospitals, with support from Iran, treated the affected promptly and no fatalities occurred. Saudi Arabia, fresh from successfully managing the Hajj season in June with no epidemic outbreaks, offered technical support and lessons learned to Iraqi counterparts on crowd health surveillance and heat stress prevention. These efforts at mass population health management highlight regional capability in handling the health logistics of millions of people, an increasingly important skill set for Middle Eastern public health officials. Chronic disease and lifestyle interventions. Across the region, health authorities are scaling up programs to manage chronic conditions at the population level, recognizing the heavy burden of diabetes, cardiovascular disease, and obesity. Saudi Arabia recently launched a campaign, A Nation Without Obesity, in late June, involving multiple ministries, private sector partners, and community organizations to address obesity as a chronic disease that affects a large segment of the population. While that campaign was launched earlier, its activities, public education, screenings for BMI, and policy advocacy for healthier food environments, continued into this reporting week, reflecting a sustained approach to improving population lifestyle metrics. The campaign aligns with Saudi's Quality of Life program under Vision 2030, and officials noted that tackling obesity is essential not only for health outcomes but also to reduce economic costs and boost productivity. Meanwhile, Qatar has been investing in its national diabetes registry and rolling out a chronic care model through primary health centers to ensure diabetics and hypertensive patients receive regular monitoring and guidance. Qatar's use of a centralized electronic record and reminder system is an example of leveraging data for population health management, the country aims to reverse the upward trend in diabetes prevalence by 2030. Refugee and displaced populations. Managing health for displaced populations is a persistent regional challenge. In Jordan, which hosts large numbers of Syrian refugees, the Ministry of Health with support from UN agencies continued providing integrated health services in refugee camps and urban centers. This week, Jordan reported that vaccination rates in Zaatari and Azraq camps remain above 95%, helping prevent outbreaks among the refugee population. No new polio or measles cases have been detected, testament to these efforts. Lebanon, however, faces a worsening situation in its population health indicators due to its economic collapse. Immunization rates have dropped and medication shortages are common. Though Lebanon had no acute outbreak this week, health NGOs warned of rising rates of preventable illnesses as many Lebanese cannot afford care or drugs. This highlights a divergence in the region. Some states are successfully managing population health through robust public services and data-driven programs, while others struggle under crises. Nevertheless, even in fragile settings there were positive steps. Yemen, though not explicitly in headlines this week, has seen some improvements in managing the cholera endemic through vaccination drives and water sanitation projects supported by GCC aid. Cholera cases in 2025 are trending lower than the peak years, showing that concerted population health interventions can bend the curve even in conflict zones. And in the West Bank and Gaza, despite all odds, local health workers have kept childhood immunization coverage relatively high, over 85% in many areas, an achievement of population health resilience amid chaos. In conclusion, the region's population health management efforts during this week reflect a mix of preventive triumphs and ongoing struggles. On one hand, countries like Bahrain, Saudi Arabia, and Egypt demonstrate that committed strategies can control or even eliminate diseases and improve health metrics across large populations. On the other hand, conflict and economic instability threaten hard-won gains in places like Lebanon, Gaza, and Yemen, requiring extraordinary support to maintain even basic public health functions. The overall trend is an increasing awareness by Middle Eastern governments that health outcomes depend on more than hospitals. They hinge on proactive policies, community engagement, data monitoring, and ensuring every segment of society, including refugees and the poor, is reached by health initiatives. The developments of this week reinforce that investing in population health yields dividends in resilience, provided stability allows these programs to flourish. Health reforms and strategic programs were prominent this week. So let's summarize this week's review. In summary, the Middle East's health trajectory for this week and looking ahead is one of determined advancement amid daunting obstacles. Key trends include 1. Healthcare transformation accelerating. Expect more digital health milestones, hospital upgrades, and region-specific innovations in the coming months as countries pursue long-term visions. 2. Public health collaboration deepening. Joint initiatives, e.g. disease elimination, training, research, will likely expand among Arab states and with international partners, recognizing shared benefits. 3. Humanitarian needs persisting. Absent political breakthroughs, Gaza, Yemen, and Syria will remain focal points for emergency health interventions, and the region must brace for potential spillover of health crises. 4. Population health and prevention rising on the agenda, from tackling non-communicable diseases to improving nutrition and mental health. A shift towards preventative population health management is gaining policy priority. Ultimately, the ability of Middle Eastern nations to sustain positive health outcomes will hinge on stability and governance. This week showed what is achievable under stable conditions, cutting-edge care and mass outreach, and how quickly those gains can be threatened by conflict and hardship. The convergence of innovation and crisis in the region's health sector makes for a complex landscape, but the clear takeaway is that the pursuit of better health and wellness remains a unifying goal across the Middle East. Stakeholders are increasingly adopting a holistic, collaborative approach to healthcare, one that integrates technology, policy, and compassion. If these efforts continue and are coupled with progress in peace and development, the region is poised to make significant strides toward healthier, more resilient societies in the weeks and years ahead. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.